Tonight in our 7 UpFront segment, we are talking about the dangerous surge of COVID-19 infections. The state setting a record high single-day total of 5,710 new cases, also reporting 26 new deaths. So far, 7,470 people have died from the virus here in Michigan. So joining me now is Michigan's Chief Medical Executive and Deputy Director, Dr. Jonae Khaldun. We thank you for being here, Doctor.
Thank you for having me on.
Let us begin with those disturbing new numbers, that sharp rise in cases. In the last few days, we've seen some schools roll back in-person learning plans, some still planning to start in person soon. I'm a worried parent on that list. What are you and the governor asking the public to do to stop the spread of this virus?
You know, I'm very concerned about our rising cases. We've got 5 times as many new cases a day as we had at the beginning of September. So I'm very concerned. But you know, the ways that we can get this curve down are the same things that brought the curve down in the spring. It's wearing masks, it's social distancing, it's not having large gatherings, it's washing hands. Those are the things that are going to get us ahead when it comes to bringing this curve down.
And Doctor, you said if we just change our behavior, we could see 100 deaths a day by the end of December. And that's if we don't change and stand up and protect ourselves. Your recommendations for people celebrating the holidays that are up and coming?
You know, it's going to be different this year. You know, I'm someone, I love gathering. I love large family gatherings. I love having dinner at my house and getting together with my parents and my grandmother. And, you know, that's not going to happen this year. I think it's really best that people avoid these large gatherings, less than 10 people indoors. It's really going to be important. And it's not just about yourself. Think about your older family member who may have underlying health conditions, who may be more at risk of having severe consequences from COVID and even dying. I think we really have to be careful this year. I know it's tough. Again, I'm dealing with it as well, but it's just what we have to do.
You know, it seems like ages ago, but it was just a few months ago that we were at the ready with a makeshift hospital set up downtown Detroit at the TCF Center, in fact. Are we going to need that again? Are hospitals prepared for this rise in cases and treating patients in and around Metro Detroit?
You know, we've certainly seen an increase in hospitalizations over the past several weeks, which is not a surprise given how we started seeing the cases increase as well. What's different now compared to the spring, though, is that most of the cases, about 60%, are actually outside of Southeast Michigan. What's also different is that we're not seeing the same number of ICU patients with COVID-19 as we did in the spring. So while we are certainly monitoring hospitalizations and we're certainly monitoring deaths and talking every day to our hospital leaders across the state, Southeast Michigan is not doing actually as bad as some of the hospitals in the rest of the state this time.
So other parts of the state, you know, may have that issue with how to treat and how to handle the influx of cases.
That's right. You know, hospitals have had a little bit of time now to understand what's needed. They've been able to get more PPE supplies, understanding how to implement their surge plans. Again, back in the spring, this was all new. We didn't know what to expect. And it's a little different now, but we will continue to support our hospital systems across the state.
Yes, ma'am. So let's talk about the importance of testing and getting a flu shot this season. How will this help in the fight against COVID?
That's right. Anyone who has symptoms, one, you shouldn't be going out if you're having symptoms. You shouldn't be going to work or school. You shouldn't be around other people, and you definitely should get a test. We've got hundreds of testing sites across the state. We've significantly increased our testing capacity. Again, that's something that's very different than what we had at the spring when only the very ill could get a test. So we want anyone who needs a test to get a test. And again, that's how we're going to understand where this disease is and prevent the spread.
We just have to protect ourselves, and that's the message you and Governor Whitmer have been saying. So we thank you, Dr. Jonae, for joining us tonight, and we appreciate hearing from you.
Thank you for having me on. Stay safe.
All right. Stay with 7 Action News for continuing coverage of the pandemic. You can get up-to-the-minute information on the coronavirus on our website, WXYZ.com.